worst part was that I couldn't lift my 3-year-old grandson. And that's something that I told the doctor. I said, I want to be able to lift Eli again.
There comes a time in your life that people look at you and they think you're healthy, but inside you know you're not healthy. I mean, when you have back pain, people don't realize that it's not something visible.
I had days where I felt really hopeless. I wondered if I'd ever be able to do the things that I wanted to do again. I had a lot of expectation of my life, and it wasn't going the way I wanted it to. I wanted somebody that would give me some hope.
Living without pain, it's not just an idea. It's becoming a reality for thousands of people in North Georgia thanks to innovative treatment options being made available through the North Fulton Hospital Pain and Spine Center. This is Back Talk. I'm Jessica Link. We're glad you're here because we have some promising stories to share with you over the next few moments. Stories of hope, of medical advancements, of what some patients might say are miracles. If you or somebody you care about suffers from back pain, you need to know that you can get your life back. Back Talk is about real solutions to spine pain being offered every day. Treatment options from injections and medication management to minimally invasive procedures like radiofrequency ablation and innovative surgical techniques such as IOFlex. These can be done in a day, with recovery occurring in weeks instead of months. We'll talk with physicians, surgeons, and staff at North Fulton Hospital and the Pain and Spine Center, as well as the patients they have treated. We want everyone with back pain to find renewed hope for reducing pain and living a better life. We'll meet Ginger, a grandmother from Cumming whose everyday activities were being impeded by debilitating back pain. We'll speak with Marty, a preacher in Blairsville whose first career as a police officer contributed to nerve compression in his spine, keeping him from doing his best for the growing congregation at Fellowship of the Hills Church. And if you've ever been misdiagnosed for leg or back pain, you'll find Jody's story encouraging. She had been told her pain was from a disease requiring treatment with chemotherapy and narcotics. But a second opinion from the North Fulton Hospital Pain and Spine Center revealed that her pain could be treated with healthier, minimally invasive options. These are real people, your neighbors and friends, finding real comfort through pain management at the North Fulton Hospital Pain and Spine Center in Roswell. You too can find that comfort and improve your quality of life. And we invite you to call in or visit the website at the bottom of the screen at any time during this broadcast. Our specialist will answer your questions and get you started on the journey to a life with less pain. Now, let's find out how former police officer Marty Duncan's life changed after treatment from the neurosurgeons associated with North Fulton Hospital's Pain and Spine Center.
During my years in law enforcement for 26 years, my expertise was locating illegal drugs that were concealed in motor vehicles. Locating these drugs necessitated us to dismantle certain parts of the vehicle. So therefore, I'd be crawling inside the interiors of vehicles, removing seats, removing dashboards, and then on the exterior we would have to look up underneath fuel tanks, and in the engine compartments we'd pull different pieces apart. So I noticed that I was starting to feel some tweaks in my back and some numbness going down my leg about that time. So through the course of that, I decided to go and seek some pain management. So I went through a series of epidurals, and it did. It helped me out for a considerable amount of time. Then the pain progressed over the years. I retired from the job in 2006. We moved to Blairsville, Georgia to plant this church. In the process of planting the church, I was still doing some traveling for the government, doing some teaching across the world in my former line of work. I remember traveling back from San Diego. I was doing a class in San Diego and had made the 4-hour trek from San Diego to Atlanta and was in so much pain that I could barely get off of the plane. I remember having to ask an elderly lady help me get my suitcase from the overhead. Very embarrassed to have had to done that, but I knew at that point that I could no longer live like this.
He was just miserable from the moment. I mean, when he woke up, he was miserable and just couldn't get out of bed. It was just really rough on him. To do the physical things that he was used to doing, he couldn't do anymore, and it was really rough on him. Plus with the traveling he was doing, traveling was really hard on him.
It finally came to a point where a friend of mine recommended through a procedure that he had done, to go see Dr. Weaver. So we made an appointment. I took my most recent MRI to Dr. Weaver and shared with him that I had already met with another surgeon and that he was going to do these things to my back with a cage and some screws, and I was extremely nervous about that. And Dr. Weaver very kindly, with my wife Susan and I sitting in his office as he looked at my MRI, he said that no, I've got a procedure that is fairly new and I think it will work for you. And I said, well, doctor, do you think you can fix it? He says, I know I can fix it. So we scheduled the surgery, and as they say, the rest is history. Within 2 to 3 weeks, I was able to do some things that I was not able to do prior to the surgery. I'm very thankful for this because, of course, I now am healthy, I'm vibrant in what I do, and the only regret that I have, and I would share this with anyone, is why did I wait? You know, I did not have to live in this pain.
I think Mr. Duncan was probably one of the first few people that, it was early on that I had used the IFlex on, and I mean, he had just a spectacular result from it. I mean, we did, I think, 4 foramen bilaterally for him, and I mean, he had almost a complete, I think, relief of this pain. I mean, he took very little pain medication. You know, that's not necessarily the case for everybody, but again, I mean, he just had a spectacular result. When people go back to doing the things that they love to do and they want to do, I mean, that's the most, I think, that's the biggest, kick I get, I mean, I'm pretty confident that if we take the pressure off the nerve, pain's going to go away, and that's good. We like that. They feel better, I feel better.
One of the things that impressed me about Dr. Weaver, number one, was his bedside manner. He didn't come off as a doctor with, obviously, with an incredible education and an expertise. He came off as an ordinary person and talked to me. In fact, I noticed, I forget what it was, it might have been a tattoo, and I hope he doesn't mind me mentioning this, but he reminded me of someone that rode a motorcycle. Well, I have a Harley, and so that kind of broke the ice for me. I remember chatting a little bit about the motorcycle, and I thought, wow, if this guy rides a motorcycle, he can't be that bad. He's down to earth. And he took Susan and I back into his office or conference room and very simply explained what I had and what was going wrong and what he could do. Now I'm able to go and do a good full workout. I don't have any pain, and it's an amazing thing to be able to do what I could do in my 20s. Obviously not all the weight, but I can do what I did in my 20s and enjoy it and get the relief that I need as it relates to, again, the mental stress of what you face each and every day. It's nice to be able to go to the gym and just kind of blow off the steam, so to speak, and to lift the weights and just enjoy it. The before and after with my lovely wife Susan is great because, again, she dealt with, she knew that I was in pain. There was no question about that. But Susan would tell you today that she has a different husband, a different person, no longer affected by pain.
Marty definitely has his life back, and we have it back to where we can enjoy things and go places that we couldn't do before because of the pain that he was in. And I try to encourage people to, why put it off when you know it's just going to get worse, when you can get relief from this and take care of it and have your life back. And I thank God every day that he's better and he's able to enjoy life the way that he wants to.
I think that's the important part of it, is you don't have to live in pain. There's opportunities and there are people that have the education and the expertise to be able to help you get through this, to get through the pain, and prayerfully to get through a procedure that will completely eliminate the pain. I know that I wasn't going to continue to live like this, and that is, again, my faith and getting over the fear of having the surgery got me to where I'm at today, having had that procedure done. I look back now and think that I had wasted so many years in pain. So I would tell anybody, don't live in pain. You don't have to. Seek the wisdom and the knowledge of those that have the expertise to be able to do what needs to be done to fix your back.
If you got leg pain, arm pain, hand pain, if you've got sciatica, I mean, it doesn't hurt to come and find out, what can be done. I would not purport that I could fix every problem that somebody comes to me with, but we can do some tests and see what the problem is and see is there some kind of solution that would be acceptable to the patient. And that might be something simple like an epidural. It might just be changing the medications that you're on. Sometimes it's just a little time to let a problem heal itself. Sometimes it's a big surgery, but there's lots of different ways to accomplish sometimes the same big surgery, and going over all those pluses and minuses for that patient and their anatomy. It doesn't hurt to at least find out what's going on and what are the options.
The most important thing that I would tell somebody who's suffering from pain is that you can't get enough information. I mean, even if you just want to come in and talk to the doctors to understand what is happening in your body, there might be options that you never knew were available.
It's important to note that surgery may not always be the best option for treating back pain, according to North Fulton Hospital neurosurgeon Dr. Thomas Belknap.
Most people who come in to see us in the office are in some sort of pain, whether it be the neck or lower back or leg or arm, and they seem to be surprised that actually the vast majority of the time we do not recommend surgery as a first-line treatment. We are actually a very conservative group and do everything we can to avoid surgery for the patients, except for in cases where it's absolutely needed. There are many things that we can do before it comes to that step, such as physical therapy, non-narcotic pain medications, even trips to the pain and spine center, where there are other modalities that can be used to treat the pain. It's only when people have failed extensive conservative treatments or have very concerning neurologic deficits where we start to talk about surgery sooner. But that being said, most of my patients will get their pain treated without surgery, which is kind of surprising to some people when they're coming to a surgeon's office.
Jody Bowles spent many years in pain after she was misdiagnosed. She found new options at the North Fulton Hospital Pain and Spine Center.
I always exercised my whole life, and I've always been very, very active. I was diagnosed with a disease I actually didn't have, and they put me on very heavy-duty steroids and chemotherapy. My husband says I'm the only person he's ever known that had recreational chemotherapy. But it powdered my bones, and I got osteoporosis very, very badly. It felt like I was made out of matchsticks for about 1.5 years. Every time I bent over very far, I'd snap a couple of ribs. And I actually broke 2 vertebrae putting a chicken in the oven. So I don't recommend, drink your milk. If you're young, drink your milk. It was hard to find somebody who didn't have a one-size-fits-all. At the time, I think they were kind of giving everybody, or most pain centers were giving everybody morphine, time-release morphine. I did not like having to depend on morphine because when you're taking heavy-duty drugs like that, you're going to be sick if you miss one. And it's not a good feeling. You're addicted, but you need it. And I didn't want to live like that. I wanted to explore other options and see if I could get off of all this medication.
I started building the pain center in 1990, and it's grown from seeing about 60 patients a month to almost 850 patients a month. So we're doing a lot of good for a lot of people, and I've enjoyed every minute. I do not believe that narcotics are the answer for chronic non-malignant pain. I think over time it reduces patients' quality of life, so we try to replace the narcotics with non-narcotics and wean them off the narcotics.
People think that pain management is a lot of drug therapy. Medications are a part of pain management, but it's not the whole thing. It will be a combination of therapies. It'll be nutritional services, it'll be physical therapy, and it'll be a lot of professional advice to get people to maintain their quality of life without being just on medications. The side effects of medications are never good.
I had days where I felt really hopeless. I wondered if I'd ever be able to do the things that I wanted to do again. I had a lot of expectation of my life, and it wasn't going the way I wanted it to. I wanted somebody that would give me some hope, and I found a lot of hope at North Fulton Pain Center. They were the first people that said, we have other options.
Most of these patients that come to see us have been through many physicians and maybe other practitioners that have told them things that they can or cannot do for them in hopes that they could get some pain relief. And when we finally get them to being better and feeling good about themselves, it's like someone has turned on a light. And that is an amazing feeling.
Gosh, I'm always looking for hope. I'm always looking to do better. I'm ready to do better. I'm ready to feel better. And the first time I talked to Dr. Joel and then Dr. DeMama and Dr. Wada, you know, each one of them brought something new and a different aspect to treatment, and it has just evolved.
We frequently collaborate on difficult patients to get each other's ideas. It allows another physician, like Dr. Domina or Dr. Wada, to see maybe a patient I'm treating and put a new set of eyes on it. He may get some ideas that I didn't have. And the same with me. I'll see one of their patients and evaluate them, and I'll have ideas that they didn't have.
The most recent thing that we have found is radio frequency. And that seems to really have made a big difference. I had one sciatic, one side done, and I've got an appointment to do the other side, and I can't wait.
Jody is a very interesting patient. When I first met her, she had tremendous amount of pain in her lower back. She received a procedure called the Simplicity procedure. Simplicity is a radiofrequency of the SI joint. It may sound very simple, but in decades, there has been a lot of difficulty getting an adequate radiofrequency of that region. Classically, other pain providers, interventionalists, would radiofrequency this by placing 20+ needles between the SI joint and the sacral foramen to get some relief. In Europe, there were these studies that were done on this very specific needle that was created to mimic the actual sacrum. It has a curve that's placed right in between the sacral foramen and the SI joint. Bottom line is, it's the most effective treatment for SI joint pain.
I was very, very pleased, and I had immediate relief, which shocked me. I expected there to be some pain from the procedure, and I don't know if that was a fluke, but I did not have any pain at all. They told me it can be up to a 4-week recovery, but I didn't miss anything.
Jody is a great example of someone that has, unfortunately been misdiagnosed for many, many years, and now that she's finally received the right procedure, it has changed her life.
One of the best things a patient ever said to me was that I was sitting in the room with them and he said, quote, unquote, was, "You've improved my quality of life so much so, and you've brought my pain down to a level that I've never felt this good before."
I actually can just go to bed and go to sleep and sleep through the whole night. I can't even, I can't tell you how long it's been since I did that. And when I get up in the morning, when I open my eyes, I'm not grabbing for pain medicine in order to be able to get out of bed. I can get up and go I'm getting up and getting my own coffee. My husband usually brings me coffee because he knows I have such a hard time moving in the morning. I'm actually getting up and making the coffee for both of us. When I play the piano, it just makes me feel like I'm exercising my brain. Now I can sit there and I don't have to worry about it, and I'm not thinking, oh, I'm going to have to take a pill and wait for it to kick in before I can sit down and play some more. None of that is happening. I'm actually living my life without being encumbered by the pain.
If you can be in a setting that you can look at what you're doing now, whether you need physical therapy, whether you need surgery might be the case. People will often put it off until they are so sore, so debilitated with pain that they can't hardly function anymore. And the whole purpose of pain management is to have people function as normal as possible.
If you hurt, do something about it. Don't pretend that it's not there. Don't try to ride it out. It's hurting you in a lot of different ways you may not even realize. There are things that can be done. Don't put it off. Go and see help. And of course, I'm a little prejudiced. I think you should go to North Fulton Pain Center.
Now, let's meet Ginger, a determined woman from Cumming who found relief with help from North Fulton Hospital neurosurgeon, Dr. Thomas Belknap.
3 or 4 years ago, I started noticing a pain in my lower back and in my left leg that was going really all the way down to my calf. I managed it for a few years because I knew how, when it started hurting, I'd just quit walking. Or if I was standing doing some kind of housework or whatever, I would just stop doing it. So that's how I managed it, and I did that for a couple of years. So it got to the point where I could not even walk through the grocery store without having to stop. The pain was that severe. I went to another hospital and they took x-rays of my entire spine and said that, you know, we really need to fix something in your neck first, which the process that they were going to use was to fuse vertebrae in my neck, and I was going to be in a halo for a couple of months. Well, we didn't like the sound of that. So I went and started doing research on the internet, and I was looking for a neurosurgeon, and I interviewed 2 other doctors, and when I interviewed Dr. Belknap at North Fulton, I just knew immediately that he was the right one.
Ginger Milligan came into our office hurting, but she also came in with such a positive attitude about her care. And she was a little apprehensive about Dr. Belknap. And once she met him and he talked to her, she felt like she was in the best hands.
I think what was amazing about her is she's able to carry herself almost to the point where she looks normal, despite the fact that she was in so much pain, and her MRIs of her spine actually would make me expect her to be unable to even function.
I mentioned to him that the first doctor said that I would need to be in a halo. And you know how sometimes when you get just this tiny little look from somebody that they're kind of like, what? You know, very slightly, because he's so very professional. And he said, well, I wouldn't do that. He said, I'll use cadaver bone and get the spaces right, and then we will fuse 4 of your vertebrae together, and then we'll screw it together. And so it will be stronger than it's probably ever been. That was it. That's all I needed to know. And I felt a complete peace about it.
The first surgery we had to do was help take pressure off of her spinal cord in her neck. She actually had severe degenerative changes in her cervical spine, which was putting pressure on not only the nerves exiting her spine, but also the spinal cord itself. The second surgery we did, once she had recovered from her cervical surgery, was to take away the pain going down her leg from her also severe degenerative changes in her lumbar spine. Over the last 5 years or so, we've been doing a new procedure called Ioflex foraminotomies, which is a less invasive decompression of the nerve roots leaving the spine, in the lumbar spine. In the past, we used to have to do large bony removals requiring fusion, but now we're able to really focus on where the compression of the nerves is and shave away the bone and ligament that's pushing on the nerve. Basically, this is a procedure that's using simple tools such as a rasp to open it up. We take the rasp, and it's almost like a flexible emery board, and we kind of reciprocate back and forth. It shaves away the bad tissue, and we remove it. Most people will leave the hospital the very next day, and we actually encourage patients to be up walking the day of surgery. The other goal is we actually try to have our patients walking up to a mile by the time they follow up about 2 weeks later.
They give you a morphine pump that first night. I never had to use it. I took Tylenol. He gave me a prescription for a narcotic to bring home with me, and I never used it.
They come in for their first post-op appointment, and they're absolutely amazing. And I look at them and I say, "You look absolutely wonderful." And the doctors who just did surgery on them within weeks, they're walking, they're not in as much pain, they don't need as much pain medicine, and they're absolutely astonished, and that they don't believe that the doctors could have helped them as much as they did.
Before I had the surgery, I had trouble doing just ordinary things. The worst part was that I couldn't lift my 3-year-old grandson. And that's something that I told the doctor. I said, I want to be able to lift Eli again. And years ago, I always said I wanted to be a play-in-the-floor grandmama. And I am. There was a time that I wasn't, but I'm back to being a play-in-the-floor Gigi. I'm at full throttle now. I can do anything I want to. For me, it's been an incredible experience. It really has.
We hope you've enjoyed this edition of Back Talk from the North Fulton Hospital Pain and Spine Center. If you're ready to say goodbye to intense pain, we invite you to call 855-302-BACK and speak with one of our pain specialists. Or you can also find helpful information on how your pain may be reduced or eliminated by visiting our website, northfultonpainandspine.com. Most importantly, know that there is something you can do, and we're here to give you the hope and the help you need. I'm Jessica Link for Back Talk. Thanks for joining us.